The CEO of Providence Health and Services admits it played favorites when it came to giving out the COVID-19 vaccine. That CEO saying insiders, some of them donors, got vaccinated even though they don't have direct or indirect exposure to any patients.
A lot of anger surrounding this. While Providence is promising changes, we wanted to know how this could happen in the first place. Fox 12's Kendra Kent dug into the story and joins us now live. Kendra?
Yeah, that's absolutely, Pete. And the Oregon Health Authority did tell us that hospital board members, other administrative staff that don't have contact with patients or don't have that indirect potential exposure should not be getting the vaccine. But again, this is what we're finding at several hospitals where they're just simply vaccinating all of their employees. Now, OHA did tell us that they do not have any plans to impose any other fines or consequences for the hospitals, saying that all they can really do is remind hospitals and other providers of the COVID-19 vaccine to follow the rules and regulations. Providence Health is in hot water after admitting that staff vaccinated some of its foundation and board members who may have not otherwise been eligible to receive the vaccine. In a statement Thursday, the medical group told Fox 12 it's offered the vaccine appointments to more than 27,000 Oregon caregivers and its own employees, medical staff members, and its statewide governing board. All groups that Providence says complies with state vaccinating guidelines for Phase 1A. Adding that only a small fraction of 24 individuals on various boards were contacted to receive doses, in some cases to quickly receive vaccines that might otherwise go bad. But Providence also added this, quote, "In retrospect, we understand that in our haste to vaccinate people quickly and or avoid wasting doses, including a small number of our hospital community, created the impression that some people are able to use their access to get a vaccine appointment. This was not in line with our organization's standard practice, and we have made changes." The revelations beg the question, who exactly is considered a priority healthcare worker in Phase 1A? If you work primarily at home for a hospital marketing department, should you be able to get the vaccine? The Oregon Health Authority says its guidelines are crystal clear, telling Fox 12, quote, "Vaccinating hospital administrators, managers, executives, board members, and other staff who don't have the greatest potential for direct or indirect exposure to patients or infectious materials is not in alignment with Phase 1A guidance." But the actual written language is pretty lengthy and does include descriptions like healthcare personnel working in facilities management, administrative, billing, and other roles. In early January, OHSU told Fox 12 it moved beyond priority groups, saying, quote, "Because we moved to quickly and efficiently vaccinate priority groups, we were then able to begin offering vaccinations to all employees and students with approval from OHA." Thursday, OHSU told us it has vaccinated more than 17,000 of its employees and university students. For people outside the hospital systems trying to get vaccines, it's tough to hear.
It makes me feel pretty crummy. A lot of things in this world, sometimes it's just who you know.
Verlene Wilson is a self-employed nurse who travels around the Portland area to administer vaccines to employees at dental clinics, radiology departments, spas, and other clinics and businesses. She's 65, immune compromised, and has been trying to get a COVID-19 vaccine since January through OHA's online system.
For the last 2 weeks, all I have gotten is a response that said, "There are no appointments available."
As an at-risk frontline worker, all Wilson wants is to be protected like the state has promised. And we did ask OHA if there are any circumstances where nurses and other frontline healthcare workers like Verlene Wilson can get in contact to try to get their vaccines more quickly as they are in that 1A phase, but we did not hear back specifically yet on that question. Now, that nurse that I spoke with, Verlene, told me that at this point she's just given up trying to get the vaccine, and she says she plans on retiring soon. Reporting live tonight, Kendra Kent, Fox 12 Oregon.